To our organizers of this event, the Board of Directors of the Philippine College of Surgeons Cancer Commission Foundation, to the Board of Directors of the Philippine Society of General Surgeons, to the Association of Women Surgeons of the Philippines, and to the Plastic Reconstructive Surgery. To our distinguished guests, keynote speakers, and stakeholders. Isang magandang umaga po sa ating lahat. Isang magandang umaga po sa ating lahat. Naman. Sa dami natin, we have to make our voices heard because now we have been given a seat at the table, but we have no effect if we do not also use our voices to make our voices heard. And this is our opportunity to do that. It is always an honor to host the National Cancer Summit, and on a personal note, to show my support for an advocacy that is close to my heart. We come together today, bound by the resolve to rise against one of the most pressing health challenges of our time. For so long, cancer has been perceived as a death sentence, a leading cause of fatalities in the country, which has stolen countless dreams, crippled so many families, and brought a dark cloud of fear and uncertainty over our society. In such bleak circumstances, our response defines who we are. Despite all the losses that we have endured in this fight, whether it was personal or professional, all of us here have been asked to do the most courageous thing, to hang on to hope, keep finding it in each other, and more importantly, to carry this light for the patients that we help and serve. The Philippines has taken big strides in addressing cancer, particularly with the passage of the National Integrated Cancer Control Act. But while this is a bold step, all of us here know that this policy alone is not enough to ensure comprehensive, accessible, and affordable cancer care for all Filipinos. We are compelled to work together to translate this law into concrete life-saving action, ensuring that every Filipino, regardless of socioeconomic standing, will have access to support, from education, early detection, quality treatment, and palliative care. With our national program setting the direction, we are asked to bring genuine change at the community level. We acknowledge that there is still so much to do. Parallel to national statistics here in Quezon City, breast and cervical cancers remain a public health concern. This is why we are truly committed to setting the standard for transformative cancer care. It is our hope to position our city as a model for cancer prevention, treatment, and support. Last year, we passed the landmark Integrated Cancer Control Ordinance, which institutionalizes a citywide patient navigation system, the creation of a robust local cancer registry, and the appointment of cancer control coordinators in our health facilities. Additionally, we also have ordinances for free pap smear or testing to women Q citizens and for our city's comprehensive cervical cancer elimination program. We have prioritized early detection, which remains one of the most effective tools in combating cancer. Our citywide screening programs and mobile cancer screening units have brought diagnostic services to underserved barangays, saving countless lives by identifying cancer at its earliest, most treatable stages. Last year, we screened over 67,000 women for breast cancer, with nearly 100 referred to next steps of care due to suspicious findings. Meanwhile, for cervical cancer detection, we provided visual inspection through acetic acid wash for 15,000 women aged 20 to 30 and HPV DNA testing for another 2,000 women of the same age bracket. a small percentage of women tested were found in need of treatment, which spelled a world of difference for them. And of course, we continue now to provide them with the treatment that they need. It is our hope to establish awareness, prevention, and early detection as the norm. But as we contend with cases in need of treatment and care, we have introduced several initiatives, including the availability of thermal ablation treatment in several of our healthcare facilities, the orientation we provide for early lung cancer screening, and our extensive efforts to expand insurance coverage for screenings and treatment through our partnership with PhilHealth and many private stakeholders. We also count on hospitals within our QC Cancer Network, turning to them for referrals for various services, from free mammogram, diagnosis and treatment of gynae and medical oncology cases, to biopsy and treatment. We likewise recognize the emotional and psychological toll of cancer. That is why we have integrated mental health and psychosocial support services into our programs. Counseling sessions and support groups ensure that patients and their families have the emotional resilience to navigate the challenges of treatment and recovery. For us at the Quezon City government, all these efforts are geared towards building a resilient cancer care ecosystem. We recognize that such requires multi-sectoral collaboration, a fact that we know from the partnerships that we already have with both public and private stakeholders. The Philippine Cancer Society is among our strongest allies in this pursuit, helping us improve our initiatives, from training our barangay health workers and running mobile clinics to establishing our cancer registry and e-Cascreen platform. All of us here are united by solidarity and a shared dream. A nation where someday cancer will not dash the hopes of our fellow Filipinos, especially those who have less in life. As we gather for this annual summit, we are reminded that each of us has a role to play, from policymakers, healthcare professionals, government, and advocates. For far too long, cancer has imposed limitations on the lives of millions. But when we act in harmony, we will be able to change this narrative. Together, we can push for something much stronger than cancer. Together, we can uphold the power of hope. We still have a long way to go, but we must move in the belief that all things are possible. It is an honor to be united with you in this cause. Here in Quezon City, we have made the commitment to eliminate cancer and address all forms that it takes for as long as I am the mayor of this city. We are investing so much funds towards cancer control so that our ordinance does not remain a paper ordinance, but becomes an instrument of hope for the thousands that continue to suffer and their families as well. So I call on everyone here, appeal to everyone. Let's all unite towards this common cause. Everything can be addressed if all of us work together and we move in the right direction. So again, it is my honor and my pleasure to welcome you all to Quezon City. At tayong lahat dito ngayon, magsama-sama, magkaisa tungo sa ating nag-iisang layuning, mawala na ang cancer sa ating piling. So mabuhay po tayong lahat, isang matagumpay na summit para po sa ating lahat. At sana po pagkatapos ng ating summit na ito, we leave with a renewed vigor, a renewed commitment, and renewed hope for all of us. Marami pong salamat, isang magandang araw po sa ating lahat.
Thank you very much.